Hello everyone, I'm Sharon Vella. I'm a pharmacist and nutritionist and work for the Health Promotion and Disease Prevention Directorate of Malta. Malta is currently implementing the best practice Grünau Moves as part of the Health4EUkids project, and this best practice aims to promote health and prevent obesity in children living in deprived areas. I shall be giving you a brief overview of the local actions, especially programmatic interventions which have been carried out in Malta. The area of intervention chosen was Hamrun. Hamrun forms part of the Northern Harbour district of Malta, as can be seen on the map. It houses a total population of 10,514 people, out of which 692 are children between the age of 4 and 12 years. It is densely populated with around 10,000 people living per kilometre, and around 25% of the population are of non-Maltese origin. Over here you can see some photos of the area. There is a local council, there are 2 primary schools, there is also a community clinic, and there are 2 supermarkets selling a variety of foods, but there are also a lot of takeaway foods selling unhealthy foods and other restaurants. First of all, we started by doing a needs assessment and prioritization of actions. The needs assessment was carried out in the form of focus group with different stakeholders and community leaders who have a role to play with children, such as priests, catechism educators, football secretaries or band club secretaries, the educators themselves teaching at the homeroom primary school and the students attending the primary school. The healthy living tool provided by the work package lead was mostly used. The healthy living tool consists of a survey containing 14 questions which assess the current situation, whereby the people doing the survey had to rate the current situation, and also they had to provide feedback about what they would like to see in the future. Following this, all the information was documented, and then a workshop was carried out with different residents and the actions were prioritized. And it resulted that education programs were mostly needed. And that's why we embarked on delivering programmatic interventions in our area. So, as part of the first action, we organized a health education program during the summer of 2024. We collaborated with the Foundation for Educational Services because they take care of the summer state schools in Malta. We produced the content of the program, and we delivered nutrition, physical activity, and mental health and well-being sessions. These were skill-based sessions, and they were around 40 minutes each lesson. They were given weekly to children aged 7 to 10 years for over 6 weeks. Evaluation sheets in English and Maltese were also used to elicit feedback from the children, and it is intended to repeat the program every year. Over here you can see some photos of our physiotherapist who first did some time in class explaining about the importance of physical activity and reducing sedentary time, and then took children to the playground where they did physical activity and playing different games such as the Robin Hood game and rock, paper and scissors game. Over here you can see more photos of the physiotherapists doing physical activity with children. Over here you can see myself, because I'm a nutritionist as well by profession, and we spoke about the different food groups, the healthy plate, and the portion sizes which we need to consume from the different food groups. We then played a memory card with the children, whereby we gave them different cards with different foods on them, and then they had to place them on the different posters of the different food groups. Over here you can see our psychotherapists delivering the mental health and well-being sessions with the children. They taught them about the importance of resilience and how to overcome challenges in life. Also, they did activities with the children which focused on building self-awareness and understanding emotions through reflection and positive affirmations. They also practiced techniques such as deep breathing, grounding techniques, and creative expression with the children. They also explained the importance of healthy habits, and they also gave parents some follow-up letters with practical tips and resources to support the emotional well-being of the children at home. Over here, you can see some health educational material which was disseminated with the children and with the parents. These included the dietary guidelines for Maltese children and lunch book, recipe book, as well as Healthy Summer recipe book. Over here, you can see the evaluation of the summer school program. Out of the 48 questionnaires considered for evaluation, we got to know that the physical activity session was the most liked session, followed by the mental health and well-being session, and then followed by the nutrition session. As you can see from the graph, most of the children liked the program, and only 3 children said they didn't like the physical activity session, 4 didn't like the nutrition session, and only 3 didn't like the well-being session. So overall, the program was very well received by the children. Then we had organized a school play which focused on healthy eating behaviors. We obviously wrote the script, and this involved 3 members of staff, 2 nutritionists and a nurse, and we performed this play in front of 45 primary school-age children and educators. Over here you can see some photos of us performing the play, and the kids enjoyed it a lot. Then we had organized as well a winter after school healthy lifestyle program in March 2025. And first of all, we had meetings with the head of school regarding the logistics, and the rooms where to give the lessons, the gym where to do physical activity, and also a room where to do the cooking class. The program was delivered to 8 and 10-year-old children and their parents or guardians. It was a 6-week program, and it involved nutrition lessons, physical activity lessons, and well-being lessons. We had sent invitations to parents and guardians and children to attend the Healthy Lifestyle program, and we created resources such as educational nutritional games and also snakes and ladders to promote physical activity, and we also provided health educational material. Over here you can see the poster reminder of the program. Over here you can see some photos depicting the lessons which were taken with the nutritionists, with the physical activity officer, as well with the mental health and well-being officer. Over here you can see some of the food prepared during the cooking class. They prepared some dips and some vegetable crudité, also some fruit kebabs, as well as an open ftira with healthy toppings. We also did a small supermarket nutrition education campaign. We contacted the owners of 2 main supermarkets in Hamrun, Alfsans and Interspar. We prepared the material to disseminate to customers. These included recipe books, shopping guides, information on salt, sugar, fat, and also coloring books for children. And then we visited the supermarket, both of them, for 4 times between August and October of 2024. In total, we interacted with around 80 shoppers, and we spent the whole morning there, basically, when we went from 8 till noon. Over here, you can see me at the supermarket. And over here, you can see me and my colleagues delivering health information. We taught the shoppers how to read food labels, to choose food which are low in fat, sugar, and salt. And we also gave recipe books to shoppers shopping from these supermarkets. Over here, you can see more photos of this event. And also here you can see us also delivering nutrition information at the other supermarket. We also took part in a multicultural activity which took place in August 30th in Hamrun. We were invited over by the Immaculate Band Club of Hamrun, and there we disseminated health material and spoke with the residents. We spoke to around 77 people, and over here we got the opportunity to meet non-Maltese residents residing in Hamrun. So over here you can see some of the photos of the event. It was packed with people. There was a really nice atmosphere. We then also took part in a family fest, which was organized by the local council of Hamrun. This took place on the 24th of November 2024. They closed the main street of Hamrun to encourage more walking and activities in Hamrun. We disseminated health material and performed health checks such as blood pressure, blood glucose tests, and we spoke to around 60 people and performed around 25 health checks on the day. It was a very good opportunity to meet the locals and to do brief health interventions and to nudge some people for better health. Over here you can see some photos we took during the day. Also, we prepared the poster campaign for school. We prepared the different posters with different health messages, including oral health, the importance of reducing sugar intake, and eating healthy snacks. And these were submitted to the head of schools, which then the head of school placed on the Facebook page, which is used by the parents. Some general recommendations from our experiences when we implemented the programmatic interventions. These included that it is important to perform a needs assessment, first of all, to assess the needs of the community and to prioritize the actions since funds are quite limited. It is important to involve a diverse group of stakeholders because the more opinions and the more information you get, the better. It is very important as well to plan ahead, as with all other projects. A number of human resources are needed to be involved, and it is very important to tailor messages and interventions to match the community values and practices. It is important to choose programs which can be sustained by the chosen neighborhood and repeated over time. It is also a good idea to train the trainer, such as, for example, to train the scout leaders or teachers and community leaders so that they can take on the project forward and ensure sustainability of the project. And it is also important to set up robust feedback systems and evaluation so that you can adjust to the needs of the community. Over here you can see the members of the working group, our director, Dr. Paula Vassallo, who is the project lead of Health4EUkids, our head of unit, Dr. Mariella Borgebon-Tempon, and myself as well. I'd like to thank you for your attention. Thank you.